A very warm afternoon for all our viewers. I thank you all for joining our Saturday knowledge sharing webinar. This is for the parents, and the topic that we're going to be discussing today would be COVID in children and what parents need to know. I also am glad to introduce myself. I am Srivalli, reporting from Rainbow Children's Hospital, Marthahalli, Bangalore. And it gives me immense pleasure for me to introduce our panelists, eminent panelists for today, who is our consultant pediatric infectious disease specialist, Dr. Manu Chaudhary, and our consultant pediatric rheumatology, Dr. Chandrika Bhatt. I welcome both the doctors. Having said that, I also would like to bring upon light about the topic that we are discussing, which is the most sought out discussion that we do on a daily basis about COVID and how do we deal with this pandemic. We at Rainbow Children's Hospital have made sure that the doctors are available round the clock in emergency services and also in our OPD from 8 a.m. in the morning till 8 p.m. in the evening to support all our patients. And the entire time, from the time the lockdown has begun, and we have been moving on. The days have not been great for us, in terms of COVID, but very shortly, I think we'll be able to come over this. We also adhere to the rules and regulations laid by our government, and we follow all the safety measures, and our doctors here would be able to throw some light on COVID in children, what parents need to know, and how do we take it further. Dr. Manu, I would request you to share a few words, and our first question, or there are so many questions that parents have asked us, and the first question that what do we need to know, what are the symptoms during COVID-19 and how do we deal with it, doctor?
Sure. Thanks, Srivalli. Good morning, everybody, whoever has joined us. I'm Dr. Manu Chaudhary. I'm a 3-year trained pediatric infectious diseases and leading the COVID task force for Rainbow Children's Hospital, Marthahalli. We are managing a couple of these cases. Fortunately, COVID-19 in children has been not very severe, and most of these patients are presenting with fever or cough. Some are presenting just with fever. Some are presenting fever with some fever-related seizure. And then if they're adolescent, they are presenting like adults where they might have altered smell or taste. Most of these children are exposed from their parents, so people in the household, because they're not really going out. And the couple of patients which I have managed have been doing wonderful. The main thing here is to understand that identifying these symptoms are very, very important. Again, how do we deal with it? So coming to that question, what we are providing our patient population is this video consultation service. So, whenever you feel that your child might have symptoms which might be, related to COVID, you guys can schedule a video consultation. One of our doctors will speak to you guys, and then we decide if your child is matching it and how to go about it. Most of these cases which we are managing with our home care plan, which we'll talk about later, we are just managing with simple supportive care, where we encourage oral rehydration, we just fever management. So basically, good news is kids are handling this infection very well, and we are able to manage them mostly on home basis.
Thank you, doctor. Thank you so much for that. I also would request Dr. Chandrika to address when to seek doctor's appointment. I'm sure Dr. Manu has added upon to it, but when do we seek doctor's appointment, and also how do we go about it?
Yeah, so thank you, Srivalli. I'm Dr. Chandrika Bhatt, consultant pediatric rheumatologist. So as Dr. Manu has already pointed out regarding all the possible symptoms of COVID in children, so if you notice that your child has either fever, cough, cold, abdominal pain, diarrhea, vomiting, altered sensorium, in which probably he or she is appearing more lethargic, more tired than they normally do. So these are some of the warning signs, what we say, that can be associated with COVID in children. And if your child has any of these symptoms, please consult a doctor immediately, either in person by taking them to the hospital, especially if they're unwell, or you can also make use of video consultation services that are available, where one of the doctors will be able to see your child and at least tell you whether you need to come to the hospital immediately or not, or whether you can just wait at home and watch. So it is very, very important, not only because of COVID, but we are seeing a lot of other infections, especially dengue coming up now. So I think to just be sure as to what is causing the fever, it is important to seek medical assistance of any form as soon as possible.
Thank you, doctor. Thank you so much. Dr. Manu, I would request you to let us know, what about vaccination for children during this pandemic? And what if, my child's due date of vaccination is lapsed? And how do we go about it? I've been getting a lot of questions. Most of our viewers and our parents are asking us questions. We have like around 15, 20 of them already come up. But I think this is one of the common most questions that is asked. What about vaccination for children during this pandemic, ma'am?
Sure. So, earlier when this thing started, we weren't sure how long this whole COVID situation is going to last with us, right? Okay. So at that point of time, we were saying, okay, let's just, we can delay the vaccination. But as new information is evolving, we know COVID has become a part of our lives, and we just get used to this new normal. Okay. There are vaccinations which are very, very important, like measles, mumps, rubella, chickenpox, which cannot be avoided, right? I think we have passed that stage where we delay the vaccinations. This is going to stay, guys. So I encourage you to reach out to your physicians to find out how to go about the vaccination. If you have lapsed on vaccination for your children, there's very well, way to catch up those immunizations. So your physician will definitely know it. What we are doing here in Rainbow is we have a very segregated way of managing our patients coming for just vaccinations. So as soon as they enter our gate, we ask, we have a questionnaire they fill. Depending on if they have any symptom of fever or exposure to COVID, they are directed to a very separate area, which we are calling our fever OPD, and managing those patients there. Our vaccination and non-sick patients enter to a different area and go to a different area. And we are encouraging like having vaccinations in early morning, where there isn't much of a commotion in the hospital. So I think it's a right time to go catch up on all the vaccinations your child might have missed, irrespective of their age. So initially we were just vaccinating below 15 years of age, but now we are saying just please speak to your consultant, through video consultation, find when they are available, and just go ahead and do the catch-up vaccination. At Rainbow, we are also providing this home visit immunization program, which you can avail to. So you can call our helpline number, and they can help you find out how to go about this home vaccination. We are also encouraging the adults as well to stay vaccinated, because apart from COVID, I think we should not forget that before COVID, there was a huge issue with flu, swine flu as well. So we are suggesting that vaccination for the whole family. So now is the right time, and your physician will help you catch up all those vaccination you have missed for your child, because we have to accept this is part of our life now.
Thank you, doctor. So you say that this is our new normal life. Moving
Yes.
on with it, I think about home vaccination, that immunization program that we have currently. I've been getting a lot of queries. The home vaccination program that we have, is it available and flexible for parents any given point in time, or are we working on a timely or an hourly basis? That's one question which has just popped up, doctor.
Sorry, I didn't get the question.
So the question is, anytime are we available for immunization, that is home vaccination, and are adults also given vaccination in the same visit, that is parents
Yes.
and children?
Yes. So we are providing the whole family the vaccination. Usually adults, we are providing the flu vaccine and the Prevenar vaccine, which is another bacteria pneumonia which can affect our elderlies. So those two we are providing our adults. And then timing and all those logistics are worked up by our team who are running the show. But our one of the doctors and our nurse will accompany for this home vaccination program.
Okay. Thank you, doctor. I'll come back to you with some more questions. I'd like Dr. Chandrika to let us know what is community spread, and can my child play outdoor games in the gated area? Like there are so many who are bound to being at home, and I being a mother myself, I am very skeptical about sending my children outside to play, because there is a fear of the spread in the community. So what is community spread, and is it safe outdoors?
Yeah. So I think most of the parents would have heard of so-called stage 1, stage 2, stage 3 of the pandemic. And there's a lot of talk going on as to which stage each country is in. So community spread is essentially stage 3 of a pandemic. And what exactly happens here is that we don't have an obvious source for infection in someone who tests positive. In the sense, you not always have the source of contact or a travel history in these people. So whereas in stage 1 and 2, most of the times you're able to trace and say probably, the contact, there was a definite contact with someone else who was COVID positive. So now with the pandemic spreading more and more, especially in India, we are seeing that there is probably a lot of local transmission that is going on, and India is probably headed towards a community spread as of now. So this is why it is very important for people to stay indoors as much as possible and step out only if absolutely essential. Obviously, essential services have to carry on, but otherwise, most of the people, especially children, it would be preferable to stay indoors as much as possible. And about playing outdoor games in gated areas, this should be fine as long as children are wearing a mask, not engaging, maintaining social distance, not engaging in group play. And what we would suggest is children do need their exercise for the day as well. So it would be better if they could engage in activities like cycling, which is more of a single person activity than a group activity. So to take all appropriate precautions, wash hands frequently, avoid touching the face, avoid touching the mask when they're using the mask outdoors. So if all precautions are in place, it should be fine for children to play outdoor games as well.
Yes, Dr. Chandrika, I have one more quick question which has just come up right now. One of our parents has a 3-month-old baby. So what are the symptoms in the baby of 3-month-old if he or she has COVID? And can parents be affected of it? Is it through sneezes, or how is it? So that's one of the questions which has just come up from one of our parents, ma'am.
Sure. So the symptom in any child, irrespective of age, is usually the same, wherein they would develop fever or respiratory symptoms like cough, cold. Very rarely we do see children presenting with, abdominal pain, vomiting, diarrhea, or even seizures in some of them, along with fever. And in a 3-month-old baby who probably has a very little interaction with people outside, usually the source would be from someone at home. So I think it would be essential for the caretakers, be it parents, grandparents, also to see if they have any symptoms or to get themselves tested as well if the child tests positive. And it is absolutely important for parents to make sure, especially in children that young, to not take them outside unless absolutely needed.
Thank you, ma'am. Thank you so much. Moving on to the next question, Dr. Manu. Is there a similar virus in which children are exposed already? You just spoke about flu. You also told that there's common cold and all that is in the air. So is there a similar virus which children are exposed already? And how do we prepare children in case of COVID-19 outbreak, ma'am?
Hello.
So I repeat my question. So is there a virus of which children? Yeah,
I
sure.
heard the
Yes,
question.
ma'am.
COVID is coronavirus. Okay, so it comes from a family called coronaviruses. They have been with us forever. They usually originate from an animal source and somehow skips to a human, and then it spreads through especially respiratory secretions. Okay, we have had various summer viruses, as we usually say, most of our coronaviruses, but they are year-round viruses, and they are the one who cause common cold usually. So this is not a new virus for us. It's it's a new virus, but we have been exposed to similar viruses in the past. And the other, epidemics which had happened before this have been like SARS and MERS, which were more serious. And similarly, this COVID-19 has become more, severe infection, because still we are getting to learn a lot about this virus. So yes, there are similar viruses which can affect children. There are other viruses apart from which Dr. Chandrika said. Dengue can also, affect children. Flu can affect children and cause common cold. There's a virus called adenovirus, which can cause high fever and vomiting, diarrhea, or breathing issues. So there are a lot of viruses which are present in our environment. So yes, there are other causes. And then I think your next question was, how do we prepare children in case of COVID-19 in our community? So it's very important to understand. I think it has been brought in by most of our health authorities of hand hygiene, mask usage, and social distancing. And all these recommendations are based on how the spread happen of this virus. Okay, so it's usually spreads through sneezing or coughing, or somebody breathing very closely who is carrying this virus. And it's very important for us to educate our children. Just please respect them as young adults. If you explain your 3-year-old what is COVID, what is coronavirus, they will understand. And from Ministry of Health, there's a amazing comic book. From CDC, there's a comic book and videos. So please show it to your children. Tell them why we are doing what we are doing, why COVID is there, why they are not going to school, and what so they need to understand why it's happening. And and then once they understand what's happening, then you teach them hand hygiene, and you are the role model. So show them what is hand hygiene. You can make it a fun game of washing hands for 20 seconds, maybe counting A to Z, or saying their favorite poem. So teach them proper hand hygiene. Tell them why we are using mask, and then how to not touch the front of your mask while adjusting too much. If you do, then clean with the sanitizer. And then talk to them about maintaining that distance from their friend when they are going in the community and playing in, probably to ensure they are maintaining that 3 to 6 feet distance from their friends who are not in the same house. So it's very, very important that we teach our children what is going on and how to take care of themselves. I think mask has been a lot of my patients' parents are like, how do I put a mask on my toddler who's all over the place? I think it's okay if they are at home and there is nobody sick at home without being a mask. But if you are out there, then they have to. Probably if you show that you are wearing it, kids really feel comfortable. Or if they have a favorite toy, maybe you can just hand stitch or hand make. There are a lot of DIY ways of making masks, and put that on their favorite toy. That will give them that reassurance, like, okay, this is a new norm, it's fine, it's nothing wrong with it. So demonstrate good habits to your children, and I think they should be able to understand you well and combat this pandemic with you.
Thank you, doctor. About the mask, like you said, that having a small, nice little Dora mask, or some nice cartoon character mask will actually.
Absolutely, I think people are getting very creative.
Right.
I actually bought for myself also, PJ Masks and all those, Spider-Man mask and all. So it really makes the children very comfortable because they can identify with those, superheroes and whatever,
Absolutely.
Chota Bheem, whatever they like. So absolutely, that's a very good idea.
Absolutely. Yes. Doctor, adding on to that, since you've spoken about masks, is it that we always have to protect ourselves with, these 3 layers and N95 masks that we get, or is a simple cotton cloth mask advisable at home?
I think at home, if you don't have a sick person, who has cough, cold, then
Okay.
at home you don't need to wear a mask. Okay.
Okay.
It's
Okay.
basically when you're leaving that secure home environment and going into the outside, that's when it's recommended. The best mask is triple layer because every layer is giving you an extra screening of the from the virus. And you can use cloth masks. It's totally fine. It's the way you manage your mask. So basically, if you have multiple numbers of these cloth masks, wash them daily. You can wash them with your laundry or soap and detergent in a bucket. Hang them in the sunlight for it to dry up. If you have sick person at your home, because now I think the pandemic, we started seeing community spread in Mumbai first for our country, then this was Delhi, then Chennai, Hyderabad, and I think now Bangalore is seeing a lot of cases where people are being home quarantined. So if you have a COVID positive patient at home, the person who's taking close care of that person needs to, especially the mothers who have small children who could have turned positive, need to wear N95.
Okay.
And N95, again, there is a way you take care of it. You can't wash it, so you can use it for 5 times, anywhere from 6 to 12 hours and just rotate that mask every 4th, 5th day. Leave it to dry in the sun. So all those precautions till your child is out of that quarantine or that family member is out of the quarantine. The person who is sick needs to be wearing a mask and being segregated in a particular room. And then, of course, if you have COVID positive at home and you might be close, and if there's a segregation is a problem, then everybody needs to wear a mask.
Right. One question which one of our parents have just asked is that is it okay to give supplements to children as a precautionary measure? If so, what are they?
So what I recommend parents now is please give them healthy, local, fresh produce. Okay, as long as you are making them eat proper food, please avoid processed food. Get rid of chocolates, ice creams, and chips. Maybe once in 15 days they get a leisure, junk food. But as long as you stick to healthy food, you should be fine. Okay, your child should be fine. There are a lot of multivitamins. Most of them are water-soluble vitamins, which if you take in, apart from what you have received from your food, it will wash out from your, while you urinate. So you can give it you can speak to your, but it should be under some physician's recommendation. So you can give it. A lot of people are getting, very excited about vitamin C tablets, zinc, all those things have come in. So personally, I feel as long as you're taking healthy diet, you should be fine. But if you plan to give your child multivitamins, it should be prescribed by a physician.
Okay. That's a great information. Thank you, doctor. I'll come back to you. Now I request Dr. Chandrika actually to let us know about how frequently, these infections actually affect. That is, what makes infections severe in children, and are children with underlying medical conditions at higher risk of severe illness from COVID-19, doctor?
Sure. So what we know as of now, by and large, this virus causes only a mild illness in children, or most of them may even be asymptomatic, which is why we say that children can be vectors of the disease, that is, carriers of this infection. But a very few or a small percentage of children can develop a severe condition along with due to COVID infection. And in terms of respiratory involvement, usually children who have underlying respiratory diseases may be more predisposed to getting severe illness, or even children on chronic immunosuppression or other chronic diseases whose immunity is probably affected because of the chronic illness may also be more susceptible to developing severe infection. But having said that, children who are otherwise fit and well, having a healthy, balanced diet, as Dr. Manu said, and are not undernourished, usually sail through this without any hassle. But a very, very small percentage of these children can develop severe infection, which we will be talking about a bit later.
I'll just add on to that, as rightly said by Dr. Chandrika. What makes infection severe? So basically, I think late recognition and parents being so uncomfortable getting their children to hospital just because COVID is going on. So late recognition of symptoms and self-managing your child at home. By that time, we are not able to offer them a proper care. By the time they get to us, these kids can have severe infection. Sorry, just wait.
COVID-19 in the Duravidin. Hey, it's time to wash your hands. Please wash your hands, stay safe and away from COVID-19. Thank you.
Wow,
these are all the
think
steps
that's a
we are
nice
taking at hospital.
Yeah, it's a nice initiative which talks about washing our hands frequently. And yes, I would request all our viewers to encourage themselves and the family members to keep washing your hands quite frequently, which is the need of the hour at this point in time and for many more days to come. Thank you, doctor. Dr. Chandrika, we have one.
Shrivali, just a minute. So I just want to add. So late recognition of symptoms can make the infection severe for these kids. Second is increase, you see your child is breathing very hard, the lips are turning blue. Those are, markers of severe infection. If they are drowsy and not, there's something wrong with your child. Please get them immediately to your closest hospital or emergency room, because that's not the time for video consultation in these children. Third is they can have, apart from the viral COVID infection, they can have bacteria infection. So they can have a urine tract infection. They can have a typhoid with them, because we are seeing these patients where we have, apart from the virus, we have a bacteria which is making the child sick. And so, the child is taking a hit that apart from this virus, they are also struggling with a bacterial infection. So that makes the child more severe, and makes this infection more severe. Children with underlying diseases. So some of the patients I'm managing in the hospital are with COVID who are having some underlying disease. So I have a patient who has asthma. So that, your child's lungs are already under, stress because of the asthma, and then the virus makes it worse. So those are the patients which might get sicker with this virus. Then there are patients with diabetes, which predisposes to infection. Then children who are on steroids. So as Dr. Chandrika said, so kids who have joint problems or any other problems where they are on steroids or other immunomodulator medications, those children are predisposed. Children who have cancers. So these are some subpopulations, or heart diseases. These are some population of children where we have to be very vigilant. So even with fever, you have to immediately speak to your physician and not wait it out and manage all these cases at home. Sorry, Shrivali, I think we can move on to next.
Yes, ma'am. Yes, absolutely. Thank you. I'll come back to Dr. Manu with some more questions. Another one most important question with related to inflammatory syndrome that we have. One of our viewers have asked, what is multi-system inflammatory syndrome in children? That is MIS. What is multi-system inflammatory syndrome in children, ma'am?
Yeah. So this is a very interesting condition and only being recently reported from India. I think other countries like US, Europe, especially UK, have reported a large number of children with this condition. So what essentially happens is, initially, as I've described, children usually have a very mild illness with COVID, but a small percentage of them, for some reason that we don't know as yet, mount an exaggerated immune response of sorts to this virus and end up with inflammation involving different organs in the body. So the usual symptoms that may be there are the ones that already Dr. Manu has described that we see with COVID, like fever, cough, and cold. But apart from that, children who are developing this syndrome may also come up with a rash, a red rash that can cover the entire body. They may have red eyes, red lips, cracking of lips, redness of the tongue, wherein the tongue almost looks like a strawberry, what we call strawberry tongue. They may have swelling of the fingers, of the toes, and children may also have, along with this, a lot of gastrointestinal symptoms like abdominal pain, vomiting, so much so that in some places, especially in UK, these children have been diagnosed with appendicitis initially, only later to be tested positive for COVID and required treatment for that. So the symptoms can involve any organ of the body, including the neurological system, wherein these children can have altered sensorium, seizures, develop a bleeding or increased coagulation in the body. So it can affect any part of the body, but what parents essentially need to know is that if the child doesn't look well with fever due to COVID, they have to bring the child to the hospital. They have to seek medical attention immediately because this condition can evolve rapidly and children can deteriorate very rapidly, requiring intensive care support as well. So it is very important for parents to not take it lightly and not resort to video consultation in such situations and bring the child to the hospital. But having said all of this, these children do very well if treated in time. There are a lot of options available for treatment, and we have a very good intensive care unit. We have a cardiologist, rheumatologist being myself, and Dr. Manu, who's an infectious disease specialist. So as a team, we can manage this condition, but what we need from parents here is to bring children in time so that they get appropriate treatment. And also, if treated early on, very few medications are required to bring this inflammation under control. But the more we let it persist, they require more and more what we call immunosuppressants. Along with this, it's also important that they have their heart function monitored, because we know that in this inflammatory syndrome, for some reason, the heart also takes a big hit. And if treated in time, there will be no long-term complications because of this. Everything can revert back to normal. But if organ damage sets in, then it becomes a little hard to revert back to how children were prior to this syndrome. So I think parents need not panic, but they need to be aware that if anything seems out of place, the child doesn't look like how they normally do, please come to the hospital.
Absolutely. And just adding to that, your child might, and this can, they might be positive early on because there was a family member, and at that point of time, your child was asymptomatic. So this kind of, amalgam of symptoms can happen maybe 2 to 3 weeks later as well, after their exposure to COVID or after their mild symptoms. So it might not be just the beginning, but it could be later on. So be vigilant about these symptoms.
Yeah, and I think that's very important to know, because even a couple of weeks later, after children test positive for COVID, these symptoms can come up. So parents shouldn't ignore, these symptoms, thinking my child has already had COVID and is probably fine, and not bring them to the hospital. So that's very important to remember.
So while we are running through this, we have one question which is apt for the discussion that we are having currently. So the parent says, Doctor, my child of 8 years and 18 months found positive, but no symptoms as of now. So I think, that is one. And then we are hearing more and more about swab tests are not reliable. And as a result, doctors are going for the CT scan and advising certain other scans. Considering the amount of radiation exposure, is it safe for a CT scan for children? So I'd like one of you to please let us know about it.
I can take that question. So the first question was that it's an 8-year-old asymptomatic. So again, as I told in the beginning of the webinar, that most of these kids are doing very well. They might not have any symptom. They only are like, there's something called asymptomatic carriers. They were exposed because their parents or somebody in the family was having the virus. Again, they can develop symptoms later on. So symptoms can the incubation period is 2 weeks from the exposure. So still they can develop, and most of them will develop very mild symptoms, and very few, as Dr. Chandrika has talked about, this syndrome will develop this syndrome. Maybe earlier, maybe later after them being diagnosed. So it's fine if your child is positive, but please stay in touch with your pediatrician through video consultation and first evaluation. If your doctor says come and see us once, because we sometimes there's something called happy hypoxia. So it's basically your child is totally fine, but when we check their oxygen level, that level is below 95%, and in those cases we have to intervene and provide your child or an adult oxygenation. So go for that first evaluation, and then after video consultation of your physician, so do that. Second question is about the swab test. So the test we are doing is the DNA PCR. So it basically picks up the genetic material of the virus, and it's usually from nose and throat they take the swab. It's quite I would say sensitive and specific, but which is like around 70%, but 30% cases it could be negative. So it could be a false negative. Your child might have it, but it could be false negative. I would go for CT scan only if the child has severe symptoms. So in cases where we still suspect, even after the tests becoming negative or coming negative, and we still suspect highly that this it fits COVID very well, that's when we go for CT. We are not doing CT just for an asymptomatic child. So, and if you have doubts, we are available through video consultation. So if parents have doubts and they want a second opinion, please reach out to us. We'll be happy to help you there.
Yes, thank you, doctor. Viewers, we also have a few of them who are asking us to translate this in our local language, that is Kannada, and I would request Dr. Chandrika to talk about it. Doctor, ನಮ್ಮಲ್ಲಿ ಈ COVID-19 ಅನ್ನೋ ಒಂದು ಪ್ರಕ್ರಿಯೆ ಏನಿದೆ, ಅದರಲ್ಲಿ ಬಹಳ ಜನಕ್ಕೆ ಸಿಂಪ್ಟಮ್ಸ್ ಅನ್ನೋದು ಗೊತ್ತಿಲ್ಲದೆ ಇದ್ರೂನು, ಅಥವಾ ಮಕ್ಕಳಿಗೆ ಆಗಿದೆ ಅನ್ನೋ ಒಂದು ಸಮಯದಲ್ಲಿ ಗೊತ್ತಿಲ್ಲದೆ ಇದ್ರೂನು ಯಾವ ರೀತಿ ನಾವು ಅಪ್ರೋಚ್ ಮಾಡೋದು ಅನ್ನೋದು ಒಂದು ಪ್ರಶ್ನೆ ಇತ್ತು ಅವಾಗ್ಲೇ. ಅದನ್ನ ನಾವು ಒಂದ್ಸತಿ ಲೋಕಲ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ಅಡ್ರೆಸ್ ಮಾಡಿದ್ರೆ ನಮ್ಮ ವೀಕ್ಷಕರಿಗೆ ಸಹಾಯ ಆಗುತ್ತೆ. ಡಾಕ್ಟರ್
Shrivali, can you just repeat the question, please?
Yes, ಕೋವಿಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಅಂದ್ರೆ ನಮ್ಮಲ್ಲಿ ಇರೋ ಕೋವಿಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಏನಿದೆ ಮಕ್ಕಳಲ್ಲಿ ಹೇಗೆ ಕಂಡು ಬರುತ್ತೆ ಅಂಡ್ ಅದನ್ನ ನಾವು ಹೇಗೆ ಡೀಲ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದು ನಮ್ಮ.
ಓಕೆ, ಸೊ ಮಕ್ಕಳಲ್ಲೂ ಸಿಂಪ್ಟಮ್ ದೊಡ್ಡವ್ರ ತರನೇ ಇರುತ್ತೆ. ಮೇನ್ಲಿ ಜ್ವರ, ಕೆಮ್ಮು, ನೆಗಡಿ. ತುಂಬಾ ಮಕ್ಳಿಗೆ ಉಸಿರಾಡಕ್ಕೆ ಏನ್ ಕಷ್ಟ ಆಗಲ್ಲ. ತುಂಬಾ ಕಮ್ಮಿ ಮಕ್ಳಿಗೆ ಆ ತರ ಸಿಂಪ್ಟಮ್ ಬರುತ್ತೆ. ಹೊಟ್ಟೆ ನೋವು, ವಾಂತಿ, ಫಿಟ್ಸ್, ಇದೆಲ್ಲ ದೊಡ್ಡವ್ರಿಗೆ ಏನ್ ಸಿಂಪ್ಟಮ್ ಇರುತ್ತೋ ಅದೇ ತರ ಸಿಂಪ್ಟಮ್ ಮಕ್ಕಳಲ್ಲೂ ಬರ್ಬೋದು. ಆದ್ರೆ ಡಿಫ್ರೆನ್ಸ್ ಏನಂದ್ರೆ ಮಕ್ಕಳಲ್ಲಿ ಯೂಶಲಿ ತೀರಾ ಸಿವಿಯರ್ ಆಗಿರಲ್ಲ ಸಿಂಪ್ಟಮ್ಸ್ ಕಂಪೇರ್ ಟು ದೊಡ್ಡವ್ರ ಕಂಪ್ಯಾರಿಸನ್ ಅಲ್ಲಿ. ಮಕ್ಳಿಗೆ ತುಂಬಾ ಮೈಲ್ಡ್ ಇಲ್ನೆಸ್ ಬರುತ್ತೆ ಯೂಶಲಿ. ಹೆಂಗ್ ಅಪ್ರೋಚ್ ಮಾಡ್ಬೇಕು? ಈಗ ಮಗುಗ್ ಜ್ವರ ಬಂದ್ರೆ ಈ ಪ್ಯಾಂಡಮಿಕ್ ಸಿಚುವೇಶನ್ ಅಲ್ಲಿ ಯಾವ ಜ್ವರನು ಪೇರೆಂಟ್ಸ್ ಇಗ್ನೋರ್ ಮಾಡ್ಕೊಡ್ತು. ಬರೀ ಕೊರೋನಾ ಬೇರೆ ತುಂಬಾ ವೈರಸ್ ಇದೆ ಯಾವ್ದ್ರಿಂದ ಜ್ವರ ಆಗ್ಬೋದು. ಈಗ ಮಳೆ ಕಾಲ ಸ್ಟಾರ್ಟ್ ಆಗ್ಬಿಟ್ಟಿದೆ, ಡೆಂಗ್ಯೂ, ಫ್ಲೂ ವೈರಸ್, ಈ ತರ ಬೇರೆ ಎಲ್ಲಾ ಕಾರಣದಿಂದನೂ ಜ್ವರ ಆಗೋ ಸೊ ಏನ್ ಕಾರಣದಿಂದನೂ ಜ್ವರ ಇದ್ರೂನು ಪೇರೆಂಟ್ಸ್ ಹ್ಯಾವ್ ಟು ಸಿ ಅ ಡಾಕ್ಟರ್ ಇಮಿಡಿಯೇಟ್ಲಿ. ಅಂಡ್ ನಾವ್ ಮುಂಚೆ ಹೇಳ್ದಂಗೆ ಇದು ಒಂದು ಹಾಸ್ಪಿಟಲ್ ಕರ್ಕೊಂಡೋಗಿ, ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಆರ್ ಹಾಸ್ಪಿಟಲ್ ವಿ ಆರ್ ವೆರಿ ವೆಲ್ ಪ್ರಿಪೇರ್ಡ್. ಅಂದ್ರೆ ಎಲ್ಲಾ ಸ್ಟೆಪ್ಸ್ ತಗೊಂಡಿದೀವಿ ಟು ಎನ್ಶೋರ್ children with COVID or fever are different from children who do not have fever. So it is absolutely hospital ಕರ್ಕೊಂಡ್ ಬರಕ್ಕೆ ಮಕ್ಕಳನ್ನ. ಆದ್ರೆ ಪೇರೆಂಟ್ಸ್ ಸಿಂಪ್ಟಮ್ ಇದ್ದಾಗ ಇಗ್ನೋರ್ ಮಾಡ್ಕೊಂಡು ಮನೆಯಲ್ಲೇ ಕೂತ್ಕೊಂಡು ದೇ ಶುಡಂಟ್ ಗೆಸ್ ಏನಾಗ್ತಾ ಇದೆ ಅಂತ ಹೇಳಿ. ದೇರ್ ಆರ್ ಮೆನಿ ವೇಸ್ ತಗೊಳ್ಬಹುದು. ಫೋನ್ ಮಾಡ್ಬಿಟ್ಟು ವಿಡಿಯೋ ಕನ್ಸಲ್ಟೇಷನ್ ಇಂದ ಅಟ್ಲೀಸ್ಟ್ ನಾವ್ ನೋಡ್ಬಿಟ್ಟು ಹೇಳ್ಬೋದು ಯಾವಾಗ ಮಕ್ಳನ್ನ ಕರ್ಕೊಂಡ್ ಬರ್ಬೇಕು ಅಂತ ಹಾಸ್ಪಿಟಲ್ಗೆ. ಇಲ್ಲ visit the hospital as well. ಹೇಳ್ದಂಗೆ ಎಲ್ಲ ಹಾಸ್ಪಿಟಲ್ ಇಸ್ ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಸೇಫ್. ಬಟ್ ಮಕ್ಕಳಲ್ಲಿ ಯೂಶಲಿ ಫಾರ್ಚುನೇಟ್ಲಿ ಒಳ್ಳೆ ವಿಷಯ ಏನಂದ್ರೆ ಸಿವಿಯರ್ ಇಲ್ನೆಸ್ ಯೂಶಲಿ ಆಗಲ್ಲ. ದೇ ಡೂ ವೆಲ್, ಬಟ್ ಏನಂದ್ರೆ ದೇ ಹ್ಯಾವ್ ಟು ಬಿ ಡಯಾಗ್ನೋಸ್ಡ್ ಕರೆಕ್ಟ್ ಟೈಮ್ ಅಲ್ಲಿ ಅಂಡ್ ಮ್ಯಾನೇಜ್ಡ್ ಅಪ್ರೋಪ್ರಿಯೇಟ್.
ಎಸ್ ಮ್ಯಾಮ್. ಸೊ ನೀವ್ ಹೇಳ್ತಿದ್ದೀರಾ ನಮ್ಮ ರೈನ್ಬೋ ಚಿಲ್ಡ್ರನ್ಸ್ ಮಕ್ಕಳ ಆಸ್ಪತ್ರೆನಲ್ಲಿ ಒಂದು ಕೋವಿಡ್ ಸಿಂಪ್ಟಮ್ ಮಗು ಬಂದ್ರೆ ಅದಕ್ಕೆ ಏನ್ ಕ್ರಮ ತಗೋಬೇಕು ಅದನ್ನು ತಗೊಳ್ತಾ ಇದೀವಿ. ಮತ್ತು ನಾನ್ ಕೋವಿಡ್ ಅಂದ್ರೆ ಕ್ಲಿನಿಕ್ ಗೆ ಬಂದು ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಳ್ಬೇಕು ಅಂತಂದಾಗ ನಾವು ಅದನ್ನು ಮಾಡ್ತಾ ಇದೀವಿ. ಅದ್ರ ಜೊತೆಗೆ ಬೇರೆ ಇದು ಮುಖಾಂತರ ಅಂದ್ರೆ ಇವಾಗ ಹೋಮ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಆಗ್ಲಿ, ಹೋಮ್ ಕ್ವಾರಂಟೈನ್ ಪ್ಯಾಕೇಜ್ ಆಗ್ಲಿ, ಪ್ಲಾನ್ ಆಗ್ಲಿ, ಅಥವಾ ವಿಡಿಯೋ ಕನ್ಸಲ್ಟೇಷನ್ ಮುಖಾಂತರ ಕೂಡ ನಾವು ನಮ್ಮ ಪೇಷಂಟ್ ಗೆ ಸಹಾಯ ಮಾಡ್ತಿದ್ದೇವೆ. ಸೊ ಅದ್ರಲ್ಲಿ ಯಾವ್ದೇ ತರದ್ ನಾವು ರಿಸ್ಕ್ ಅಲ್ಲಿ ಇಲ್ಲ, ಪ್ರತಿಯೊಂದನ್ನು ನಾವು ಕ್ರಮಬದ್ಧವಾಗಿ ಮಾಡ್ತಿದೀವಿ ಅಂತ ನೀವು ಹೇಳ್ತಿದ್ದೀರಾ ಅಲ್ವಾ?
ಕರೆಕ್ಟ್. ಈಗ ಒಂದ್ ಮಗು ಜ್ವರ ಹಾಸ್ಪಿಟಲ್ ಬಂದ್ರೂನು ದೇ ಆರ್ ಟೇಕನ್ ಬೇರೆ ಕಡೆ ಕರ್ಕೊಂಡು ಹೋಗಿ ದ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಡನ್ ಇನ್ ಅ ಸೆಪರೇಟ್ ಏರಿಯಾ, ಬೇರೆ ಜಾಗದಲ್ಲೇ ಮಾಡ್ತೀವಿ. ಸೊ ದಟ್ ದೇರ್ ಇಸ್ ನೋ ಮಿಕ್ಸಿಂಗ್. ಅಂದ್ರೆ ಈಗ ಬೇರೆ ಮಕ್ಕಳು ವ್ಯಾಕ್ಸಿನೇಷನ್ ಬಂದ್ರೆ ಅವರು ಫುಲ್ ಸೇಫ್ ಆಗಿದ್ದಾರೆ ಅಂತ.
ಬಹಳ ಮುಖ್ಯ, ಅವ್ರನ್ನ ಬೇರೆ ಇಟ್ಟು ಇವ್ರನ್ನ ಬೇರೆ ಚಿಕಿತ್ಸೆ ಕೊಡೋದು ಬಹಳ ಮುಖ್ಯ. ಮೇಡಮ್, ನನ್ಗೆ ಇನ್ನೊಂದು ಪ್ರಶ್ನೆ. ಮನೆಯಲ್ಲಿ ಅಜ್ಜಿ ತಾತ ಹಿರಿಯರು ಇರ್ತಾರೆ, ಮತ್ತೆ ಮನೆಯಲ್ಲೇ ಕೆಲವೊಬ್ಬರಿಗೆ ಈಗ ಶುಗರ್ ಕಾಯಿಲೆ, ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಆಗ್ಲಿ, ಅಥವಾ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಅಂತ ಕಾಯಿಲೆ ಇರೋಂಥವ್ರಿಗೆ ಅವ್ರ ಜೊತೆಗೆ ಮಕ್ಕಳು ಅವ್ರ ಜೊತೆಗೆ ಬೆರೆತು ಅವ್ರ ಜೊತೆಗೆ ಆಟ ಆಡ್ಕೊಂಡು ಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್ ಏನು ಸಿಂಪ್ಟಮ್ಸ್ ಇಲ್ದೇ ಇರೋ ಸಿಚುವೇಶನ್ ಅಲ್ಲಿ ಆರಾಮಾಗಿರ್ಬೋದು, ಅದ್ರಿಂದ ಏನು ತೊಂದರೆ ಇಲ್ಲ?
ಮಕ್ಳಿಗೆ ಏನು ಸಿಂಪ್ಟಮ್ ಇಲ್ಲ ಅಂದ್ರೆ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಮಿಕ್ಸ್ ಮಾಡೋದ್ರಲ್ಲಿ. ದೊಡ್ಡವ್ರಿಗೂ ಏನ್ ಸಿಂಪ್ಟಮ್ ಇರಬಾರ್ದು, ಅವ್ರಿಗೂ ಮಕ್ಳ ಜೊತೆ ಇಂಟರಾಕ್ಟ್ ಮಾಡ್ಬೇಕಂದ್ರೆ. ಸೊ ಎವ್ರಿ ಒನ್ ಇಸ್ ಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್, ಇಲ್ಲ ಏನು ಕಾಂಟ್ಯಾಕ್ಟ್ ಹಿಸ್ಟ್ರಿ ಏನು ಇಲ್ಲ ಅಂದ್ರೆ ಒಬ್ರನ್ನೊಬ್ರು ಮಿಕ್ಸ್ ಮಾಡೋದ್ರಲ್ಲಿ ಮನೆಯಲ್ಲಿ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ. ಮಕ್ಳು ಹೊರಗಡೆ ಹೋದ್ರುನು ಆಟ ಆಡಕ್ಕೆ ವಾಪಸ್ ಬಂದ್ರು ಆಸ್ ಲಾಂಗ್ ಆಸ್ ದೇರ್ ಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್ ಮಿಕ್ಸ್ ಮಾಡೋದ್ರಲ್ಲಿ ಮನೆಯಲ್ಲಿ ಏನ್ ಚಿಂತೆ ಇಲ್ಲ.
ಓಕೆ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಡಾಕ್ಟರ್. ಇದನ್ನೇ ನಾನು ನಮ್ಮ ಡಾಕ್ಟರ್ ಮನು ಅವರಿಗೆ ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಕೇಳೋಣ, ನಮ್ಮ ಆಂಗ್ಲ ಪ್ರೇಕ್ಷಕರಿಗೆ ಕೂಡ ಗೊತ್ತಾಗ್ಲಿ. ಥ್ಯಾಂಕ್ ಯು. Dr. Manu, I would request you to address this. Should we limit children to be interacting with older adult or people with other chronic medical conditions? And can our children be, what do we do and how do we take about?
Sure. So I think if your child is totally fine, there's nobody, no cough, cold, fever, there's nobody sick at home, please let them interact with the elderly. Already they are, facing such an abnormal, routine for them. They're supposed to be out there in the school, in the preschool, and playing and, mixing with their friends. So it's equally like a lot of emotional stress for them as well. So please let them play with the elderlies, with the family members. But there's few things you have to be very, very watchful. If your child has any cough, cold symptom, they should definitely be segregated from elderlies 55 plus. Irrespective, I think during this pandemic, in next couple of months, make it a habit not to kiss around the mouth, okay? And make it a family habit not to share spoons and utensils. Because the main way this virus is spreading is through your respiratory secretions. So as long as you are, following those norms, it should be okay if your child is asymptomatic. So please let them play. Then second question was about pets, right? So there are very few cases where pets have got COVID. Okay, there's some reports from US, but they got it from their owner. So the pet human, basically, human of the pet, basically. So if your child is asymptomatic, your pet is fine, please let them play. Actually, if you have COVID, you can spread it to your pet. So in those cases, I would say, maintain a distance, but otherwise, please let them have a normal life at home.
So we limit ourselves if we are positive, not to be around the pet, but if the pet has to be with us when we're asymptomatic or no symptoms at all, it's just another normal day, is what you say.
Yes.
Doctor,
but then introducing those new habits of not sharing spoons, not kissing around the mouth, because there could be asymptomatic carriers with this local spread happening.
Absolutely. Doctor, one of our viewers have a question for you. One was having stomach pain and fever 10 days back, but today we've got tested it positive. So what do they do about it? That is one. And to add on to it, can MMR vaccination be delayed during this time, doctor?
Okay. So how old is the child that they mentioned?
They have actually not mentioned how old the child is, but they have told that,
Sure, sure. So here's the thing. Again, coming back to the testing aspect of things. We are checking the genetic material of the virus.
Okay.
The genetic material of the virus can linger in your body for even like weeks. Okay, 6 weeks. Doesn't mean the virus is active. Okay, so if your
Okay.
child's symptoms have improved, that means it might be a dead virus which has come positive. Okay.
Okay.
Or they are in very low limit and still the test is so sensitive that it's picking up it as positive. That's why, because this virus can linger on for so long, we as a community and the protocols have been not to repeat the test if we already know this is COVID. Okay.
Okay. Okay.
The only reason COVID might be tested still in such cases is when they are very severe, or there is a family contact and then everybody gets tested, and that's when you get to know, oh, it was COVID, which my child has initially. So I would say nothing to worry about it. Watch the symptoms, stay in touch with the doctor. No need to get it repeated, okay? Unless your child is deteriorating, and then your physician can plan accordingly.
Sure. So you asked me how old is the child? The parent just replied the child is 8 years old, ma'am. And also parent has a concurrent question. I think with this would be one of my last questions that I will ask for them. The remaining I would ask them to also consult us through video consultation or visit the hospital and take it up, because answer, I think that we should be able to answer one-on-one. But this is what you recommend for rest of the family for isolation at this status. The same parent asking subsequently.
What you're doing, so I think this is a general question I can answer. If there is a COVID positive, which we are going to see, guys, it's very contagious virus. We will see it. We'll see it in our families. So if there's a COVID positive in the family, if it's a child, then one parent or caregiver will have to be with that child, right? That person needs to wear a mask, N95, when they are getting close contact with this child, managing them, doing hand hygiene, especially after diaper changes or cleaning up their secretions. So maintaining those. If you have an isolated room, that's most ideal. So keep these positive patients in those rooms. There are very clear-cut guidelines how to do home isolation, and we have this home care plan where we are providing one-on-one nursing, where our nursing is calling these families, checking, providing them pulse oximeter, providing them home temperature monitoring, and then our nurse call them every day, find out how they are doing, update doctors. So usually I'm running that for our hospital. So update the doctor how the child is doing, and then we do video consultation every other day. So we end up in those 2 weeks of isolation, we are providing very good backup. So they have to be isolated for at least 2 weeks. Or at least 3 days without symptoms and 10 days since the first onset of symptoms. So very specific guidelines your physician should be telling you, and if there are any doubts, they can reach out to us, video consultation. But these patients have to be segregated, their utensils have to be different, their laundries can, some people say do it separately, some people are, it's fine if we run, just do an extra cycle and a lot of heat, just do it or dry it in an extra heat cycle. So those are some of the precautions you need to do if they are positive. Now, actually, I don't suggest testing the whole household if they are asymptomatic. Okay, what we are doing is, if the family, because irrespective, the whole house will be basically quarantined, is not allowed to go out. So if they develop symptoms, then they are being tested. But again, it's local government protocols. Please follow those protocols and reach out to your doctor if you have still queries about it.
Yeah, I would just like to add one thing here.
Yes, doctor.
Yeah, so this parent said this child has abdominal pain and fever. If the abdominal doesn't settle, I would tell them they need to visit a hospital or at least go through to video consultation. Okay,
yes,
because I don't think this is something that can be ignored if it persists.
Yes, absolutely, absolutely. We will set up a video consultation for the parent who has asked us very shortly. Ma'am,
Yeah.
Dr. Chandrika, I have a question. I think
Sure.
I would want one of you to answer this, but then our baby is WHS syndrome kid. And
Okay.
what are the precautions that needs to be taken for her? WHS
Okay. Can you just
syndrome, ma'am.
can you just expand what WHS is over here?
That's the question that has come up from a parent. Okay, we'll come back to that. We'll answer them what that is. And
Yeah, because
I'll
this
take the next
does
question.
not seem to be a very common abbreviation. So it would be
Okay,
better.
fair
if
enough.
you
We'll
can
come
tell us
back.
what
We'll come back
exactly
with
the
that.
condition.
We will answer to them.
Sure. Yeah.
Sure. Dr. Chandrika, if someone at the apartment is COVID positive, this is a question that why do we seal down the entire block? And is it
Yeah.
correct way of doing it? Why do we seal down the entire block?
Yeah, although it does seem like an overkill to seal the entire block just because one person has tested positive. But like Dr. Manu keeps saying this, it is important to do it mainly because we don't know for how long this person who tested positive was incubating the virus.
Okay.
It takes not everyone manifests the symptoms the day they get infected with the virus. Some of them may have a lag phase of a couple of days before they actually manifest symptoms. So during that period, if they have, we wouldn't know where they have moved around in the apartment. So which is why to take extra precaution to prevent further local transmission of the virus is why the government usually suggests sealing down the entire block of the apartment. But even then, people who are engaging in essential services like doctors, nurses, paramedical workers are allowed to step out. And for the rest of the community, they're asked to step out only if absolutely needed. And it would be better if people could stick to this protocol of staying indoors for the stipulated time for as long as the apartment is sealed down.
So maybe there is a lot of common area contacts, and there is so many other
Absolutely.
things that are there.
Yeah. So because it's almost impossible to know whom all that person has come in contact with before he or she has manifested symptoms of the virus. So to halt the spread of the virus further, anyone who potentially could have come in contact with that person usually is people staying in the same block of the apartment because they would have used common areas like the lift, the lobby area, or the parking area. So this is why they sealed down the entire block just to make sure that this is probably, like I said, an overkill, but it probably is important in preventing further local transmission.
So the whole concept of break the chain.
Precautions.
Yeah.
That's
Exactly.
right.
Yeah.
Yes.
Yeah.
Dr.
And
Manu,
I think with now the number of cases increasing, we have to take all these precautions if indicated. Absolutely.
Dr. Chandrika, one more question here. If my baby has COVID, then whether we can come to the hospital for vaccination or not, and to add to it, home vaccination, is it available for newborns?
So if the baby has COVID, they shouldn't be stepping out of home for vaccination until the quarantine period is over. And during this time, it is essential to consult a pediatrician via video consultation and make sure it is okay for the baby to stay at home. Because especially a newborn baby, we would probably keep a low threshold unless they're completely well. For them to stay at home. So when the child has symptoms of COVID, is COVID positive, vaccination has to be delayed until they recover from this illness. Otherwise, it's fine for babies to have home vaccination as well, because usually, at least in our home vaccination plan, we have a doctor and a nurse going to the community to do the vaccination. So it should be absolutely safe and fine for even newborns to have their primary vaccination at home.
So I think every place has its own policies. So depending, like, can we check the weight of the child during this home visit? Is the physician who's going well equipped to take care of a newborn to ensure everything is okay? So I think check with, I would say to people, check with this home consultation vaccination service if they are fine with. So just consult before.
Okay. Dr. Manu, to add on to it, one question that has come up, I think this is a very, very important question that we have to address, is if a child becomes COVID positive, would Rainbow Children's Hospital continue to treat them, or then those kids need to be moved to other hospital? In addition to it, are you providing treatment for COVID in Rainbow Children's Hospital? What is the process and how do we go about it?
Sure. So currently what we are doing is, if there is a family where the child becomes COVID positive, they reach out to us. So the first thing is to video consult them. We are evaluating in our emergency room and in our segregated area called fever OPD. So totally segregated from rest of the hospital, these
Okay.
COVID positive children. If they are mildly symptomatic or asymptomatic, we are enrolling them in our home care plan and doing our bit regarding daily nursing and providing them pulse ox and doing video consultations. If I feel or the doctor on call feels this child needs admission, where they might need oxygen support, they might need ICU based on like how their underlying diseases, we are providing them care. So we are not saying no, but we have a very dedicated and segregated area for these children. So a separate ward, separate nurses, separate doctors, separate management for these patients. So we are not turning off any patient who's coming to us or who we might have admitted in the first place and later on we find out. So we are providing full care for children who end up here and managing them. We have a great team with us. We have a specialist rheumatologist, a great ICU support, and then myself managing their infections. So yes, so we are taking care of these kids. We decide where they'll be managed, and accordingly we go ahead with the care.
That's right. Thank you. So the next is, what is the process for home vaccination service and making a call to home vaccination? What timeline can we expect the vaccination in? So this is like the process that they want to know for home vaccination support.
I think just reach out to our number of home isolation, home vaccination, and they should be able to provide it.
So I will add to it. So we are available for home vaccination services, and you can please reach out to our toll-free number, that is 1800-2122. That's 1800-2122. Thank you, doctor. Again, another thing is, what if children get fever? Is it important to admit, which you have already addressed? But what about the emotional health in children, doctor?
Yeah, so I think guys, this is a very strong message I want to provide to my parents. We cannot ignore the emotional health of our kids. It is equally stressful for them, not going out, playing with their friends, not going to school and having normal activity. They can present emotional stress in various ways, where they're not eating properly, sleeping late, throwing more tantrums. So please recognize them early, okay? I would suggest to manage this stress, have a routine, continue their routine how they used to do before this whole pandemic happened. So there are a lot of online classes that are happening. There are a lot of online engagement that is happening if your child is, a preschooler or something. So have a routine. If you're working from home, tell your child that this is my work now, my office, and you have to limit your coming here, so they understand. And when I take a tea break, I will be interacting with you. So inform your children why you are not interacting with them even being at home. Okay. Second is involve them in family daily chores. So very simple chores where they can pick up, they can rearrange their toys, their books, maybe pick up some fruits which they want to eat. Give them choices. Okay. Third is engage with them so make sure you are having family meals together. Okay, so they see you, they see that there's somebody who's supporting me and there for me. And play with them, have cardboard games, have carom or any Uno, whatever simple games depending on what age group your child is. You can have family yoga time, you can have family, I don't know, dance time. Make them talk to their friends. So amazing, this video conferencing is such an amazing tool. So make them talk maybe once a week or twice a week with their friends. So please take care of their emotional health.
Right.
Yeah.
Sure.
And I think just to add in, especially for
sure.
I think for adolescents and teenagers, it's going to be particularly difficult this time.
Yes.
When they are not able to interact with their friends, go out, socialize as much as they did previously. And it's very important for parents also not to be very harsh on them and to accept that everyone is going through different times now. And help children go through this without creating a lot of fear and stigma around this condition.
Right. I was about to come to that question, Dr. Chandrika. Social stigma. I would call it COVID stigma. I would not call
Correct.
it social stigma. But now I think, most of our kids at home are always at home, and then they don't get to come out a lot. But you added to it, and yes, there have been
absolutely.
A lot of, yeah. Please go ahead.
Yeah, I think Shivali, as you said, I think most of us need to accept that we are all at a risk of getting this infection one day or the other. No matter how much we try, there is still a possibility of us getting this infection. And to stigmatize this condition, and there are a lot of videos circulating on media where people have recorded the BBMP van going to houses where someone has tested positive. I think people should stop doing all these things. They need to empathize with those who have this condition because most of them actually recover, come back and lead a normal life again. It's probably a blip for around a week or two that they will experience, but there's no reason why anyone should be stigmatized because they have COVID. And in fact, not just in India, worldwide, there are so many people now infected that probably having COVID is the new normal. So I don't think stigmatizing anyone is the right way. And coming out of this pandemic without COVID is important, but also is to retain our empathy and humanity as well, I think.
True, absolutely, absolutely. Doctors, we are running short of time. I think the other questions that we will have to take, we will take it as a one-on-one, and we will revert to all our customers. Having said that, Dr. Chandrika and Dr. Manu, I thank you very, very much in joining this particular webinar. And this was more about what parents had to know. A lot of them are thanking you wholeheartedly, and they will reach you very shortly. So there are various parameters for our patients to get in touch with, and one would be the video consultation, which is the safest as of now. Just with a click of a button, we are available, and you can again reach out to us on the toll-free number. Very easy steps for us to take it further and help our patients. Also, to adding to that, like the two of you have added so much of information, valuable information, which related to home vaccinations and our plan that we have for home quarantine as well. So we are available. Would request all our viewers to come back to us with any queries again, and we will revert to it shortly. And Dr. Manu and Dr. Chandrika, thank you once again. And thank you so much for adding so much of information. And it was a pleasure. Thank you.
So
thank
I think I want to end by saying, like, the world might not be same again, but I think we have opportunity to build a better one, So hang in there, stay home, stay safe, take care.
Yes, stay home, stay safe, take care. Absolutely, yes, doctor. We shall follow it. We shall follow your footsteps as well. And there is a small thing that I'd like to add upon is SMS. What is SMS? S is social distancing, M is masking yourself, and S is sanitizing. So thank you, viewers. It was a great time. We will come back to you with another webinar shortly on all the queries that are coming up. And all the viewers have been really humble enough to wait to all the questions and answers that have come across. Thank you very much. We end the session with that note. Have a great day. Jai Hind.
Thank you.